All right, everyone. We're going to go ahead and get started. Hi, everyone. Happy Wednesday. Thank you so much for joining today's webinar. My name is Jaquarius Jackson. I work with the Baylor Scott and White Wellness Team as a wellness advisor too. I've been with the team here approaching about 2 years now. A few of the different things that we offer are first our monthly webinar series. We also offer a few digital wellness platforms and our one-on-one interactive coaching for stress management, nutrition coaching, tobacco cessation, also diabetes management, which is in conjunction with our pharmacy team. And I can talk about all those a little bit later on in our session. My background personally is kind of primarily in nutrition coaching and exercise science. And I'm really excited to talk to you all about today's topic, which is going to be on diabetes management, which is something that is really close to my heart. Today's webinar is going to be on diabetes and your eyes. Today we'll discuss a little bit about how having diabetes can lead to some different eye conditions. In today's session, the goal is to leave with these 4 items on the agenda. The first one is going to be learning about diabetic retinopathy. The second, identifying some signs and symptoms of common eye disorders. When we get to that section there about those common signs of eye disorders, you will notice a lot of those kind of brush over and are similar to each other. So we'll really talk about the importance of eye exams and how we expose which ones are more particular to which certain eye disorders. The third one there, reviewing how eye doctors examine the eyes to determine if you do have any eye disorders. And then number 4, most importantly, discussing lifestyle management skills to prevent those different eye disorders. So here, diabetes and our eye health. It's easy to kind of take your eyesight for granted. So knowing diabetes is the leading cause of vision loss in people 18 to 64 years old. So we're thinking about that kind of age range. That's pretty much the duration of your life. There are no obvious signs or symptoms for what that vision loss are. What you'll find in a lot of people that they will have some of those kind of precursors, such as like blurry vision and things like that. And for some people, it will be kind of a sudden thing. We'll talk about that importance of getting those eye exams later on, but this is one of the reasons why is that some of these do have those obvious signs. As a quick kind of reminder here, you guys are welcome to be interactive with me during this session. I do ask that if you have any questions to try to hold off on them to the end of the session, just to make sure that we have time to get through the entire presentation. If I am kind of able to find a gap during any of the slides, I will make sure I answer any of the questions then. As another reminder, you can also participate and interact with me by using the 3 chat bubbles at the bottom of the screen. You can click on those bubbles and they have options for you guys to utilize that chat feature where you can interact with everyone that's in the group, or you can send a personal message to myself. So we'll kind of give it a little bit of a quick try right now, but no pressure at all. If you guys don't want to participate, this is kind of be just for fun, kind of loosen up the energy a little bit. Since we are talking about eye health a little bit, I'll kind of do like a little bit of an icebreaker. Ask you guys 2 questions. So the first one here, kind of tell me if you guys prefer glasses or contacts. If you do wear glasses, tell me if you're a round, circle, or oval glasses type of person. If you wear contacts, tell me on average how many times you maybe poke yourself in the eye trying to put your contacts in. And I'll give you a third option too. If you don't wear glasses or contacts, describe your perfect pair of sunglasses to me. And I'll let a few of those responses kind of trickle in. All right, I see one response in there. I see the glasses option. They prefer square. I see another one. So the cat eye shape and contacts, and then oversized sunglasses. And then I see another one. Can't do contacts. They make my eyes dry. I kind of second that one as well. I see glasses oval. I see another glasses for rectangle. My glasses, they're square right now. They transitioned kind of over my lifetime. I was definitely like 100% like oval guy. Then I transitioned to like the circle. Then I went into the rectangle, but now I'm like 100% square guy. So thank you guys for interacting with me a little bit. As a reminder, you can use this full feature a little bit through the remainder of the chat. So jumping in back here into our PowerPoint presentation. So today talking about vision loss and diabetes. Diabetes can damage your eyes over time and can cause vision loss or blindness. I do want to add kind of a disclaimer here. This will not happen to everyone who has diabetes. Also, those people who do get an eye disorder, all of them will not have vision loss and or blindness, but those are possible complications. I will discuss later in the session, but of course, early treatment, detection, and management are all going to be key things here. So our first slide here, vision loss and diabetes. When it comes to diabetes, the retina will reveal most diabetes-related eye cases. Two of the most common are macular edema and retinopathy. So speaking just a little bit about the retina, I'll use a little bit of kind of a science terminology here, or more like ophthalmology words here. But the retina is going to be a thin layer of tissue that is at the back of the eye. And I'll give a little bit of a visual to think about it in a little bit more of a simple terms. The first way you can imagine the retina, imagine it acting like a screen that captures light and sends visual information to the brain. A more simple way I like to think about it, I like to imagine it as a TV screen. Maybe you guys own one of those really, really big TV screens that used to sit on the floor. Back in like the 90s, it was the big square TV box that had like the plastic screen in front of it. If you took that plastic screen off of it, it had a strip of rainbow lights right behind of it. That would be an example of the retina. The retina would be that plastic screen in those old school TV boxes. Those rainbow color signals, so that strip that is behind that TV screen, are sent to the brain through the optic nerve. I'll provide more information about that shortly, but those signals are what create the images that we see. Some common retinal conditions are diabetic retinopathy, which is going to be what we primarily talk about today. And then macular degeneration, both which we'll cover during our session. And then also retinal detachment. We won't discuss that one too much, but I do want to briefly add that it's when the retina pulls away from its normal position. So the retina actually detaches from the eye. Now, this does cause vision loss, but in some cases, it can be repaired by surgery. So diabetic retinopathy. So you'll hear me kind of mention a lot in this session talking about vessels. Diabetic retinopathy, also referred to as DR, is caused when high blood sugar levels damage blood vessels in the retina. We see here some symptoms. The first thing I want to point out there, it says often none. So some people can go their lifetime noticing and not having any symptoms of diabetic retinopathy, especially if they do have healthy eyes. Some common ones we see there are going to be blurred or distorted vision, and or seeing spots. We see treatment there, good diabetes management, eye drops, surgery, and this treatment is going to be very similar for all the eye disorders that we'll talk about. As mentioned here, you will hear me talk about vessels a lot during our presentation. But vessels, they're going to be those very tiny red thin lines that you see there on the image of those two eyes there. And those vessels are responsible for transporting oxygen and nutrients to the body. The way that high blood sugar in itself actually affect the arteries of the eyes are kind of the same way that the arteries and the vessels affect the rest of the body. That high blood sugar actually causes the arteries to harden, kind of very similar in the way that cholesterol hardens fat in the body as well. And it causes those capillaries to reduce a little bit. So think about the way the blood flows through the body. Whenever those high blood sugar molecules start to increase, you are not getting as much flow through there. So you're starting to have reduced blood flow circulation. Now with diabetic retinopathy, because of that reduced blood flow circulation, you'll see in that image at the very bottom below, you have a few more red lines there. That increase in those red lines there is notating excessive bleeding in the eye, which is also called hemorrhaging. That happens in the eye there and can also be seen in an eye exam. That would probably lead to some of those more extreme complications or symptoms that you see, such as the blurred vision, or seeing spots when it comes to diabetic retinopathy. When it comes to how to catch it early, you'll see this synonymous with all the rest of our slides, but an annual dilated eye exam is going to be the way. And then I'll explain exactly what happens during that process when we get to that slide later on. So here in our images, I just wanted to provide a visual of what it may look like in some cases of having some of those different symptoms. Picture to the far left, in the big picture, you'll see what it looks like with those blurry black spots. On the top right, you'll see there what it looks like for a distorted image. So a little bit different from blurry. Blurry image, everything is going to be in space, but just not quite focused. In a distorted image, everything is a little bit out of position. So maybe something that should be sitting right in front of you is maybe like an inch to the left or inch to the right. Another one I do want to focus on a little bit more is that very bottom center picture. I mentioned how sometimes in diabetic retinopathy, you have hemorrhaging or excessive bleeding behind the eye. That bottom center picture is an example of what it could look like in a more extreme case. So some risk factors. These risk factors that you see are really going to be very common throughout um, all of the different eye disorders I talk about, but pretty much along with all of our different kind of health disparities that we live with every single day. The longer that you have diabetes, the higher that your risk is going to be developing any type of eye disorders. As we know, lifestyle choices, especially those such as smoking, are going to be some of the biggest ways to develop some of these things. Those high blood sugar levels, high blood pressure, high cholesterols, all those things, as we saw in the previous slide, are going to be things that worsen that retinal blood pressure. Pregnant women with diabetes may be at a higher risk. We've seen that very first sentence above. Anyone with type 1, type 2, or gestational, which is going to be the pregnant women group, can develop diabetic retinopathy at any time. So the stages of diabetic retinopathy. So there are four different stages of diabetic retinopathy. The first thing I want you guys to kind of notice between each one of those stages, that's going to be a little bit synonymous between each one of them, is going to be that word proliferative, which simply means to rapidly increase or grow. So when we're talking about each one of these stages, it's talking about how fast the blood vessels are growing or how fast the condition is worsening. There are four stages of this, and like I said, it's pretty much notated about how rapidly damage is happening to the blood vessels. The first one is going to be more of a mild case. In the first one, it's more of an early stage, and it has just small areas of retinal blood vessels. So you probably won't see that eye looking as much red in that early stage. It has just very tiny, small swelling areas where blood has been leaked at, but it still can be seen during the eye exam. You'll typically have no symptoms in that mild stage. Some doctors will kind of say this is kind of the wait to watch area to see if symptoms progress any further. In that second stage here, you'll see it's called the moderate stage. The moderate stage, what typically happens here, the damage to the blood vessels does become a little bit more extensive. The larger areas are affected, and the retina begins to swallow. So going back to that picture I showed, you will probably see a little bit more of that eye becoming a little bit more red, like I showed on the previous image. I did show some of those symptoms. So in that moderate stage, blurry vision may start to develop, especially if the retina does become swollen. And you may develop macular edema at this case too, but we'll also discuss that eye disorder here shortly. To the same extent, there may not be a terrible amount of noticeable changes in that moderate stage, but we'll notice some more here when we get to stage number 3. So stage three, severe. Now a large portion of retinal blood vessels are now blocked. So we definitely notice some reddening of the eyes. And if we take an eye exam, we for sure notice that hemorrhaging word I used. So we definitely notice excessive bleeding behind the eye at this point. Another thing that's happening at this point, behind the eye, the retina is also not getting enough oxygen. And remember, the retina is responsible for transporting oxygen and nutrients to the rest of the body. Now, because in that severe stage, the retina is not getting any oxygen, the eye is also going to start to disform into a different color. If any of you guys are familiar with what cataracts looks like, the pupil turns kind of like a gray color, and you'll see it in the next slide. If we're looking at this image of this guy right now, it's not shown in this visual, but in that severe stage, his entire part of his eye that's black, that part of the eye starts to turn gray because the eye isn't receiving any oxygen anymore. In the last one, proliferative. So this is the more extreme case. So what happens again? The retina is trying to compensate for that lack of oxygen, and it creates new blood vessels. But those blood vessels are super, super fragile. Now, because of that, you are a little bit more exposed to that retinal detachment that we briefly talked about. You do have all of the symptoms at this case. So you have dark floaters, you have the blurry vision, and you also have may have that sudden vision loss, or vision loss in one or both of the eyes. At this case, immediate medical intervention is super necessary to try to prevent any further damage any longer. Glaucoma. This will be our next disorder we talked about. There's not a picture of kind of what the managed case of glaucoma is going to look like here. Glaucoma is going to be an eye disease that causes damage to the optic nerve. So we take one small break and look over to our image there. The optic nerve is going to be kind of that stem that sits over at the back of the eye. That nerve is what carries visual information from the eye to the brain. Glaucoma is often associated with high eye pressure. That eye pressure usually comes from some type of imbalance of fluids in the eye. So, too much blood or something like that behind the eye. If untreated, glaucoma can lead to permanent vision loss and sometimes even blindness. When the pressure inside the eye increases, it can cause damage inside that optic nerve, but it is gradual vision loss from the peripheral vision. So when I'm speaking about the peripheral vision, if you guys are able to, I want you to do like a really quick thing for me. Take your finger and just put it straight out in front of your face, and move your finger all the way over to the left side as much as you can, and all the way over to the right side. That is your peripheral vision space, and that is the space that's going to be distorted in the case of you getting glaucoma. Now, pictured here is what we call angle closure glaucoma. So this is when your peripheral vision is blocked. Some symptoms of angle closure glaucoma are going to be severe eye pain, sometimes nausea, and then blurred vision. Now, I do want to note that this pictured here is only one of four different types of glaucoma. The most common one that is not pictured here is going to be normal tension glaucoma. It's what we call the silent thief of the night, because it's that gradual vision loss that I mentioned earlier. Sometimes it happens when notable symptoms come about until it's too late. So there are usually no symptoms at all with that one, but it can be seen on a normal eye exam. So cataracts. Before I get into cataracts a little bit more, I kind of want to explain this image that we see here. So going back just a little bit, I talked about in our slide about how some extreme cases of diabetic retinopathy are going to cause that eye to turn completely gray. We see here in cataracts, just the pupil is gray. So that very, very small black part of the eye in that bottom image is gray. With an extreme case of diabetic retinopathy, the entire eye in itself is going to be gray. So that is one way to differentiate it between cataracts and diabetic retinopathy. Cataracts typically occur in people associated with diabetes. Like I said, in cataracts, the lens of your eye becomes cloudy due to the breakdown of the protein. So just that small part, not the entire eye. Your lens of your eye is normally clear. It's what helps us focus light onto the retina. That lens is also what allows light perception into our eye and what allows us for response to whatever light is around us. So imagine going to the eye doctor right now. They do that light test on you. That's what's responsible for the movement that's happening there. Now, cataracts, it's usually developed really, really slowly, and it's more common as people age. So you don't see it as common in the younger age groups. But again, there we see some treatments there, and we also notice a very, very common theme there between all of our eye disorders on how to catch it early by having that annual dilated eye exam. And then our last eye disorder here. So I made some brief mentions to it in some previous slides, but diabetic macular edema. This is when our tiny blood vessels in the retina, they leak fluid out, and that fluid causes buildup and swelling. Now this one is going to cause distorted vision, and again, may lead to permanent vision loss, kind of as with all our other disorders. Now this complication here is going to be more kind of that central part of the retina. Remember, the retina is responsible for image. This is where you get your like sharp, detailed images. So think about when you can see things really, really clear. This occurs when your high blood sugar levels cause blood vessels in the retina there. And this swelling can cause, like again, like I said, blurred vision to that central vision. Make things really difficult to see. You'll notice that people who have diabetic macular edema, they have more trouble seeing or recognizing faces, and they do have more trouble seeing at night as well. Over time with this disorder, the eyes become really weak, and it also can become sometimes leaky. So disorder can also sometimes cause a lazy eye because of weakened muscles behind the retina. The swelling of the macula there, so we see it pictured right there on the image. We see what a healthy one looks like, and then we see what that swollen one looks like there. At that bottom image with the red kind of swelling there in the center of it. Same thing with this progression there with all of them. If left untreated, it can lead to the kind of case of blindness. Now with this one, we still want to get that dilated eye exam. A few other ways to kind of catch this one early. The eye doctor can put a special dye into your eye. They put it into the vein of the arm, or they put it into the vein of the arm, and then it highlights blood vessels in the retina. That helps the doctor to see if you have any leakage or abnormal areas there. They can also do what they call an OCT scan. It's an optical coherence tomography scan. That imaging test provides like a detailed cross section of the retina. They can detect swelling that way too. So kind of unlike the other ones, most of the other ones are just seen with a typical eye exam. With this one here, we do have three different ways we can test for it. So with all of our test diagnosis, there isn't a ton of information here that I want to picture on the slide. The biggest thing I wanted to reinforce and that we saw on every single slide is getting that annual eye exam. That's going to be the best way to diagnose. And the only way to diagnose is getting that exam done at the eye doctor. I put a few notes on there kind of about that frequency, but a standard eye exam for most people is going to be yearly. For type 1 diabetics, you want to have the eye exam within 5 years of your diagnosis, especially. So if I'm diagnosed today with diabetes, I definitely want to make sure within this 5 year span, I go get that eye exam done. But if I'm keeping up with those regular eye exams, I should get it done within that year regardless. Even if you don't have symptoms, you have super healthy eyes, like I can see things clearly. I have none of those at all. The sooner the better, because as we saw on some of those slides, some of those eye disorders do not have any symptoms at all. Here I put like a quick little test on the screen, as I said, like you guys for to interact with me a little bit. This will kind of lead into our next slide. We're thinking about some of those different exams that the eye doctors are doing. This is one of them, and I want to tell you guys a little bit why when we get over to our next exam. This here is called a visual acuity test. This is one of the things that the doctors do, which will help explain if you have any of those different eye disorders. I'll keep this up here for about the next 20 seconds to see if you guys can read that very bottom line on the screen. Nice. I see one person in there got it there. Um, Nice. So I see a few people in the chat are able to read it there. One person, maybe not so much. And what you'll notate there is that that red line there has a separation between where you should be able to see. You want to be able to see it pretty close to the very bottom, but at least everything above the red line. So at the eye doctor exams, what's happening here? So a few different things they're going to be testing for. So the first one there I already showed you guys, visual acuity. So this refers to how clearly you can see. And as I showed you there, it's going to showcase that based on how clear you can see as those images are getting a little bit lower. The second one, the intraocular pressure. This is a little bit more important, especially when it comes to that glaucoma test. This is making sure that you don't have that heavy buildup of pressure down behind the eyes. It's actually taking a picture of the image of. It's actually taking a picture of what it looks like behind the eye whenever you get this test done. The eye muscle function, this is referring to how well you can move your eyes. So I kind of use that peripheral vision test. The doctor puts his finger straight out in front of you. He tells you to follow his finger left to right, up and down. That is what that test is going to look like. The peripheral vision one, kind of in similarities there. And then the last one, the pupil response. So I talked a little bit about cataracts and what the response of that looks like. And how in extreme case of cataracts, you have the gray pupil. This assessment looks at that and how the pupil reacts to light. So that test is done when the doctor is using the light and he tells you to look straight, or follow the light there in the case of your different eye exams. Again, all of these things are done in correlation and help out to let you know if you have any of these different eye disorders. I mentioned those dilated eye exam. It is super, super, super important that if you have diabetes, to make sure you're getting a dilated eye exam and just not a regular eye exam. During these exams, the doctors are going to put eye drops to dilate the pupils. The black circles that are right in the center of the eye, as we saw in the previous image, and a few others. Those drops are going to numb that surface. So it will take about kind of 15 or 30 minutes for them to fully dilate. If you guys ever have seen that dilation before, the pupils are that really, really small in the center of the eye. And once they're there and dilating, they fully turn the eye a little bit larger, and sometimes your eye looks completely black after dilation. When they're done doing that, they're able to be able to diagnose you with or without any type of eye disorder. And they'll usually keep you around a little bit for that. Some things I do like to add, there are a few side effects after the exam. Some people may experience blurry vision or light sensitivity, or trouble kind of focusing on close objects. I always like to kind of tell people after these exams, if you know you're going to get one done, maybe bring someone with you to the exam to drive you home, and or kind of have sunglasses with you on the drive home after that, because they do recommend people to not drive for several hours after the exam, unless the doctor says it's okay for you to do so. Treatment here, there are a few options here. They're going to be pretty synonymous to each one of those. I mentioned the wait and see approach, which is just really in lieu to the early stages to see what level of treatment that you may need. Injections, laser surgeries, and then the vitrectomy. This is really going to be when the doctor makes small incisions in the eye. That's going to be to repair any of those blood vessels and to remove any scar tissue if you may have any. And then our kind of last follow-up slides here. So you do have diabetic retinopathy or any of these other eye conditions. These are just some good tools to stay mindful of if you are living with any of these diabetes eye conditions. The first one's going to be just educating yourself. So you're doing a good job already by being here if you do have any of these conditions, by just learning more about the symptoms and the progression of the disease. There are many different treatment options out there, and if you are definitely in those early stages, there are plenty of ways for you to make sure that that disease doesn't become any further than where it is. Education is always going to be at that kind of forefront, to be a foundation to be prevention and management. Continuing on with those comprehensive exams, I provided a visual of exactly of what's going to happen in those exams. So I hope that was able to showcase you that those exams are not as scary at all. They're pretty kind of straightforward. And some of those things you can kind of even test for very quickly for yourself at home if you need to. Managing your blood sugar, we know that's just kind of a common everyday thing that we want to do in the management of our diabetes care. And then utilizing visual aids and technology, especially kind of in the area that we live in. Any of things are, if any of these things are starting to become more progressive, we do have some of these different visual aids and technologies at our hands to kind of help us out in those spaces of like the blurry vision, or even if we are in that more extreme case of vision loss in maybe one or both eyes. Remember to keep up with your medication, maintaining your health numbers. So remember your blood pressure, your A1C, and your cholesterol. And then knowing that there are emotional support groups out there that you can also engage with as well. And then lifestyle management. Those really kind of pair along all with everything in our last slide as well. We know of all of these things very, very straightforward. All of these things are going to be able to help one control your blood sugar levels, and then also be able to reduce that risk of damaging the retina any further, or increasing any of the blood pressure in any of those blood vessels. As a reminder, early detection is always going to be key. Management is going to be key as well, and then early treatment. So this is just one of my biggest takeaways that I want everyone to kind of have through the process, kind of as I talk about this presentation. And then there's our last note here. As a reminder, you have that member portal to interact with if you are part of the Baylor Scott and White Health Plan. The member portal is going to be a very great tool to actually interact with. One, to schedule appointments, and two, to kind of get with, if you schedule those appointments, go see the eye doctor and maybe they post kind of any results for you there. So I encourage you to go seek that. You can find care there and eye doctors that may be in the network for you to get your next scheduled eye exam done. That kind of ends my presentation here. Thank you all for joining me so much. Thank you so much for being interactive in the chat. And thank you for kind of sharing your choices with me for your rounds or your circles for your eyeglasses, and kind of the test that we did for your visual acuity. I hope you guys were able to take something away from the presentation today. As a reminder, the biggest thing that I wanted you all to take away is that management, treatment, and prevention are going to be the biggest things that you guys can kind of learn with your diabetes care and preventing eye conditions. As a reminder, we do these webinars once a month. Our next one is going to be next month on December 4th at 11 a.m. Where we'll be talking about HIV, STDs, and some other different health disorders. So we definitely hope you guys are able to join us again. Thank you guys, and we hope to see you next time.